Okie Country 101.7, and time for Lauren Rich of Rich Consulting to join us this morning. So glad to have you here. How are you?
I'm good. How are you?
Doing good. Chronic pain is the theme today.
Chronic pain is a pain. That is absolutely right.
It can become a pain in more than one way.
Yes.
Chronic pain, dealing with it. And you can deal with this, believe it or not, with therapy. And that's what you do.
And that's what a lot of people don't know. They assume that pain can only be treated through medications, and that's how we end up in things like an opioid epidemic.
Yeah, which has wreaked havoc on the world.
Absolutely. The entire world, specifically, the southern United States and those who are impoverished, and on and on and on. So in thinking about that, when people initially get chronic pain, the knee-jerk reaction is that I'm in pain all the time, that I have to make it go away completely, and the reality of chronic pain is that it will probably never go away completely. It will never be a 0 on that 0 to 10 scale, but that doesn't mean that it's not manageable and that people can't cope with it.
Right.
And in comes therapy.
Does that mean that your injury isn't ever healed, or does it become you're healed, but then the opiates themselves create a false pain that has to be. You get what I'm saying?
Those are two separate questions.
I know, and I'm taking you there.
So
I'm sorry.
Chronic pain, I would classify it better, not necessarily as an injury, but something like fibromyalgia, a cancer diagnosis,
Right.
Lupus would fall in that category, degenerative disc syndrome, which every veteran and American has. I'm trying to think of what else would fall in that category. I mean, what can you think of that is also a chronic disease?
Well, there's a lot of them like that.
There's a lot of them.
And
so
then
that's more of the chronic side.
Okay.
As far as the opiates go, opiates hit, or the medication hits the opiate receptor in your brain,
Right.
which makes you think that the pain goes down, and it probably does temporarily,
Mm-hmm.
but the real pain skyrockets when you come off of the opiate. So
Right.
if it lasts for 8 hours, the pain will skyrocket from hours 4 through 9,
and
so
I
to
guess
speak.
where I was kind of going though, it cannot even be a real pain.
Right,
But pain
right. It's a
created
withdrawal
by
from
the withdrawal, right.
from the receptor in your brain.
And so some
Yes.
people feel they still have the pain of
Yes.
the injury.
They'll feel that the pain
Yes,
is
they do.
worse
Right.
because they're coming off of the medication.
Not to
Yes.
confuse folks, and I didn't know which direction you wanted to go, but it's kind of important because it would really require a physical diagnosis, and
That's right.
then obviously if you're in some form of addiction or dealing with chronic pain, you're going to need therapy because there's a lot to
And if you're
work
one
through.
who's had an addiction in the past, almost I would say across the board to any type of substance, that your reaction to pain will be different than others, and your reaction to a pain medication or coming off of a pain medication is going to be different than maybe other counterparts. And so that's when CBT, or cognitive behavioral therapy, for chronic pain comes into play. And generally speaking, those are modalities that take anywhere from 10 to 16 weeks. And we initially start by just understanding pain, and then we get to move into pacing. And all that pacing is learning to have an active lifestyle before the pain takes you down. Okay, so if you're one who likes to do yard work and you want to go all day long on Tuesday, you can do that, but you're going to be down Wednesday through Saturday.
Yeah, because of the pain.
So if we learn to pace our activities and we take breaks every 15 to 20 minutes, maybe every 30 minutes, then we can actually preserve what's left in the tank, so to speak, and we're not exhausted Wednesday through Saturday.
Right. You don't want to blow your whole week
Yes,
over one day.
yes,
Makes
exactly.
sense.
And that's what people do, and then they get frustrated, and the belief system that I'm a failure or I'm not good enough comes into play.
Well, more and more of that too, as we age, you're going to pick up more aches and pains, and you kind of
Naturally.
apply the same thing without having a major thing. I mean, you pick
Yes.
up back pain, knee
Yes.
pain.
And you have to think about
Can't overdo it.
You have to think about, what was your career choice? If you're a truck driver, naturally you're going to have hip and back pain. If you're in the military, I don't know a single military veteran, man or woman, that doesn't have some type of back pain because of the weight that your body has to carry, the shape of what it is carrying, and the burden on your spine and hips. That's just part of the package. And so thinking about what your job was, whether it was truck driving, military life, landscaping, farming, small work with your hands, those kinds of things, those will, eventually you'll have some wear and tear, so to speak.
At what point do you realize therapy may be what you need? Because it doesn't sound like the first thing you would reach for if you're having chronic pain.
Unfortunately, I don't think it's the first thing your doctor talks about.
Right.
And really they should. Before we are talking about medications, or maybe at the same time we're talking about medications, we should be talking about what can we do that is not in pill form that will make things better. And I had one come in last week who I said, why are you here? And he said, I'm here for my wife, typical man answer.
Right.
And I said, well, how will we know when we're done with therapy? What do we want life to look like? And he said, I want to go fishing again, I want to go hiking, and I want to be able to go with my wife to 2 or 3 stores and not be exhausted. That is a measurable, attainable goal and can be completed within a certain amount of time, 12 to 16 weeks if he does the work.
Right. That's awesome. Well,
So
it's
if
a
you're-
light at the end of the tunnel.
So the answer to your question is, if you are not doing the activities that you enjoy, or you're not doing the activities you once enjoyed, that's when you need to come in. And the biggest kicker is, if you still have a desire to do those things but no energy, or the pain is too bad, that's when you know you need to come talk to somebody, because a pill cannot fix that. But
Right.
the good part is that you still have the desire.
And not having a desire is a topic for another show.
That's right, not falling that depression category.
Yes.
Yes.
And that's another. Maybe you're physically able, but you mentally don't have the desire to do the things
No
that you
giddy
do.
up, so to speak.
Right, and that is a sign that you need some help. So tell our listeners how they can get a hold of you. Rich Consulting,
Rich
right
Consulting,
here in Muskogee.
912-2266, FaceSpace, YouTube,
Facebook.
the interweb. Sorry, yes,
And her
Facebook.
own YouTube channel. Just
Yeah.
look up Rich Consulting.
Yep,
So glad
absolutely.
you're here. And
Pleasure.
thanks for bringing that up. Chronic pain, dealing with it through therapy.
Totally manageable.
And doing it early. Because
Yes.
you don't want to pick up an addiction to opioids or whatever.
Totally manageable.
It is. Thanks for being here this morning.
You're welcome. Thank you.